Good morning, ladies and gentlemen. Welcome. We're going to talk about congestive heart failure and why we need to educate our patients. Lately, we're finding that we are getting a lot of readmissions for heart failure. We are also, when we're doing callbacks on these patients that we do during different shifts, we're getting told by the patients that they're just not sure what they're doing or what they're supposed to do or what they should watch for. So, after completing this class, we hope you'll be able to explain why it is important to educate a patient on heart failure and to educate the patient on how to monitor for different signs and symptoms, and also be able to demonstrate a teach back. And at the end of the class, we'll do the teach back. We are going to have you team up with a nurse next to you and kind of practice with each other so we can get more comfortable with what we're doing. I think if we're more comfortable doing it maybe with each other, then we'll be more comfortable doing that with our patients. We have a heart failure example I wanted to show you. This is not a true patient here, but it's a case study of a patient. So this male patient, 76 years old, came to the emergency room with shortness of breath. He states, "I noticed I have swelling in my feet. I can't get my shoes on. I have not been able to get to sleep. I have gained almost 10 pounds. He has vital signs as follows: 98.7 for his temperature. His pulse is 110. His blood pressure is 170/88. His respiratory rate is at 28, and his oxygen saturation is 92%. Lungs on auscultation have crackles, in the bilateral bases. Chest x-ray shows signs of congestive heart failure and cardiomegaly. The BNP is elevated. Patient placed on oxygen 2 liters via nasal cannula. Patient was given Lasix 20 milligrams IV push, and patient was admitted to the hospital. He was here 2 weeks ago and diagnosed with heart failure. Patients coming back in after being diagnosed is a failure because these patients are charged a lot of money and they need to be educated the first time that they're in the hospital. What do you think is going on with this patient? When should he have called his doctor? What signs should he have watched for? Congestive heart failure is a disease that affects many of our patients. Many of our patients come in to the hospital as a readmission for heart failure. It is important to educate, very important to educate, while they're in the hospital. As a nurse, it is a failure. It is a disservice to them if we don't educate them. The goal is for nurses here to realize the importance of education for our patients. The goal is also to learn of methods to use to educate the patients. Patients want to be able to take care of themselves. They don't want to go home and have to come back. The last thing they want to do is come back to the hospital after they've been discharged. Congestive heart failure affects around 6 million people in the United States. It is a worldwide problem. Metra and Tearlink found that heart failure is common and has a high mortality rate, especially in our elderly. It is a disease that patients have to learn many times to deal with. They have to be able to take care of themselves when they go home. They have to know what they should watch for. They just need to be able to understand. But the education for heart failure should start the day they're admitted. It should start that first day. because there's so much information they have to get. And so we need to spread that out over time so that they don't get overwhelmed, because too much is overload and they don't remember what you talked to them about. So it's very important to give it in bits and pieces, and each nurse take a bit and a piece and give them that education. That way they can absorb the whole picture. They can absorb the whole thing. Many of the symptoms that they come up with are weight gain over a few days to week, and edema in all extremities can happen. And sometimes they even get periorbital edema, which is around the eyes. That is one of the signs. Some patients complain of feeling tired and short of breath. They may be coughing. They may have be just restless. They may not be able to just calm down. They may feel depressed. They may feel sad. They may be less active. They may just be very tired. These are all signs and symptoms of congestive heart failure, and these patients many times they need to seek help with these symptoms before it worsens. Like, they could call their doctor and say, I'm feeling this, so that the doctor could address it before they have to become a hospitalized patient. They need to be able to manage when they get home. They need to be able to their heart failure. They need to be able to do activities that maybe just a little bit at a time. They need to exercise when they can. If the physicians say it's okay to exercise, they need to be able to exercise. They need to follow a low sodium diet. They don't need to eat a lot of salt, because that will cause them to retain the fluids. They need to also be watching for that edema in their legs and their feet or their hands, and noticing that, weighing themselves every day, getting on that scale in the morning and checking their weight and seeing what they are. And some of our patients may not be able to see, so we need to advise them to get the scales that talk to them so that they can monitor their weight. And also, we need to also try to have them do their activities in clusters. Maybe if they're tired, maybe they should take a little bit of time and go in and do a little bit of the kitchen, and then go, finish up a few things, and then go sit down and rest for a little bit. Don't overdo it. But mainly, if they can walk, they need to walk. They need to get that exercise if they can. Many times they need to they may need family support, because they may feel sad or getting depressed, and those are all things that need to be looked at and addressed. We are one good way to educate these patients is through a method that we use called Teach Back. This is a nurse teaching the patient and giving examples, as well as demonstrating the way to do something. The patient is then expected to teach back what they were taught. These can be open-ended questions that kind of make them stop and think about it, and you tell them and you want them to explain to you what they're going to do when they go home. This was found to be very important, that we include, sometimes if they'll allow their families to be included, it's important that we include their family in this discussion. We don't want the families left out if the families can be involved. Many times these patients can be depressed, and they do need their family for support. So, and teaching the patient may not be enough. Maybe sometimes, if they do have that support system, teaching that family on what to watch and what to do, because sometimes patients go home and they're in denial and they're not watching what they're supposed to, but the family can be involved and look out for that patient. So that's an important part of the nursing also, is to make sure that they're retaining this information. And so just taking that time, I know we had the pamphlet that you guys read that we give to our patients. That's important that you read that and that you understand it. So when you're educating these patients, we're giving them this information. We need to be able to teach it what it is so that they know what they're looking at. And the only thing I have left really is we have a quiz that we're going to give you over what we just went over and that kind of thing. So, and what's, what you already know. Also, I want to thank you all for being here and for listening to this, and to please work with each other and practice this teach back, and when you're ready to be checked off, let me know and I will come over and we will check you off. We just want to make sure that we're doing the right things for our patients, and we all care about our patients. And as as nurses, the important thing is that we take that extra time and we show them that we care, because we are caring nurses. We all care about our patients, and God wants us to take care of our patients, and that's what we need to be doing. So thank you very much for this time, and you guys have a great day.